Cultural Implications, Chapter 5. These are the definitions you need to be familiar with and know out of your Chapter 5 book. And they are, of course, in blue within the chapter in the front page. And this chapter starts on page 77. So one of the things I want to just get your mindset and to have clear is a few definitions and knowing the difference between an immigrant and a refugee, because it'll help you understand the mindset of these two different groups of people. An immigrant is someone who chooses to move to a new country, who has a desire to adopt the beliefs and values of that country they're seeking to move into, okay? A refugee is someone who is being forced out of their own country. They don't want to have to leave, but they're being forced out due to war, due to poverty. They don't want to have to leave, but they must. And they do not want to take on or assimilate the beliefs and the values of the country that they're going to. But they have to go there to survive. And so that makes a huge difference when they are in this new country, because of the fact that they want to stay within their own identity, within their own values, their own traditions, and not adopt or take on that new country's values, belief systems. You also want to make sure that you go to page 84 and really review and understand those culture-bound syndromes. And as we talked about earlier, make sure you get into your HESI small book and review over those elements of culture-bound syndromes that are discussed there, especially coining and attack of the nerves. Those are the most two popular, and we'll discuss those in just a little bit. These are the objectives that we'll be working on. And one of the things I'm going to go over, you are always, as a nurse, to ask a patient, not assume, but to ask a patient, what is their preferred language? Even though someone may be proficient at speaking English, when English is not their primary language, you need to make sure that you are able to provide a translator, not an interpreter, but a translator. We want someone who can translate the information for us so that we know what the patient is saying and that can do the same thing back. We want someone who is certified to do this in medical terms so that we understand what is going on. There is a difference between an interpreter and a translator. And we'll get a little bit more into that. But the big thing between that I want to make sure you understand is this person is certified in doing this versus qualified. A qualified person is maybe a family member. And a patient may not tell a family member everything that is going on. The family member may not want to tell us everything that is going on. So we may not get all the information. They may interpret what the family member is saying to us. And so we may not get all that we need to have to assess our patient accurately and to gain our information that we need. So we have some terms. Minority status. It's a subset within a group of people who think themselves or thought by others as different within a group. Okay, so say you consider yourself Caucasian. Within a Caucasian group, you could be Jewish. And that is a subset of a Caucasian group. Minority status. Race is defined by genetics. Ethnicity is common heritage and history. We share the same worldviews and how we think. On page 78 talks about cultural norms, beliefs, attitudes. Okay, what is normal? This is how we define what mental illness is through culture. We define these things. This is what determines what cultural norms are. It's based on these values that we set. So basically, in 2043 in the United States, it is predicted that we are not going to have a majority minority nation. That's when it's predicted that we are going to be much more of a melting pot. And so we're not going to have 51% of a population making up a majority group. Yes, the non-Hispanic whites are going to continue to be the largest single group. However, it's much more of a melting pot is what is predicted going forward. So on page 80 in box 5.2, or table I should say, table 5.2, there is a breakdown. And this is how we're going to break down looking at our cultures. This will get you started. You have Western, Eastern, and Indigenous cultures. You will need to pull out and look in your larger Hesse book, your NCLEX book, looking at what German versus Asian versus Vietnamese versus Dominican Republic, what specific regions, okay, are going to be a little bit more specific towards. But what we're going to do is start in this class of breaking it down into three major areas of looking at things: Western, Eastern, and Indigenous. Okay, so Western tradition thoughts are the United States, Canada, the European nations, Germany. This is how we look at things. You first off are an individual. So when you go to introduce yourself, you introduce yourself as, hey, I'm Teresa Thody. So you see yourself as an individual. And we teach and raise our families, ourselves, our belief system as that you're autonomous. You are to make your own decisions. We raise everybody to be independent functioning. Okay? We raise you to go to school, to go get a job, to go live out on your own. We raise you to be self-reliant. Your mind and your body are separate entities. Now, we're starting to change that. And we are now getting much more understanding that if you don't have a healthy mind and emotional level, it's going to cause you to be physically ill or cause your physical illness to not recover fast. So Western tradition is starting to understand this more. However, it's still, there's a separate entities yet. We don't have it all blended together and doing the holistic component as well and as effectively as Indigenous and Eastern. We still see it as separate yet, but it's improving. We also see that disease has a cause and there is a treatment that is aimed at that cause. We see that time is linear. Oh my God, what does linear mean? That means there is a line, it goes forward, okay? Time goes forward, it's linear. And success is obtained by preparing for the future. Okay, success is obtained by preparing for the future. Oh, what does that mean? We go to school so we can have a better job, to make better money, to have a 401k so we can have a good retirement. We prepare for the future. Eastern tradition is different. So your identity is based on your family. So instead of being in Western, where you say, I am Teresa Thody, now it is, I am the daughter of Roland and Barbara Thody. I am the sister of Philip, Paul, Angie, Debbie, Barbie Thody. So you learn your identity is based on who you are in the family, your connections to your family. Your mind, your body, and your spirit are all one entity. So if one is not functioning properly, there's an imbalance within the body, mind, and spirit. They all have to be within balance to be healthy. Time is circular and reoccurring. That is your yin and yang. One of the things with Eastern tradition, I always try to remind people, Kung Fu Panda. Think of that when he's spinning. And you see the yin and yang, the black and the white, spinning around in circles. It is circular. You are born into a fate, and you are duty to comply. Again, you are born into a fate. So you are, before you are even born, it is already predetermined what your purpose is, what you're supposed to do. So when that happens and you're born, then your purpose, you have that duty to comply. If you don't, what's going to happen, there is going to be an imbalance that will take place of your mind, body, and spirit. Something bad will happen, and you'll be then caused, disease is caused by a fluctuation in those opposing forces of that yin and yang, because you didn't comply to the duty that you were born in fate to comply to. Then your indigenous cultures. Now, indigenous means that these are populations that are here on Earth in an area thousands of years before. So oh God, now I can't even say the word. Aborigines. Oh, you guys will say it later and laugh at me later about it. Are American Indians. So think about those that have been on this earth and living on this earth a long time, and why I say earth. So how they see this themselves is their place is significant on the place of humans in the natural world. So their identity is based on tribe. So when they're introducing themselves, I'm a Sioux Indian. I am an Omaha Indian. Okay, they introduce as a tribe. How about a native Alaskan? Okay, they would introduce themselves based on their tribe. And their person is an entity only in relation to others. So they don't exist without being with another person. Disease is caused because there is a lack of harmony between the individual and the environment. Disease, again, is a lack of harmony between the individual and the environment. And this is where shamans come into play. medicine men. This is helping bring back the harmony. If you damage the earth, you damage the person. They get sick. So think about the reservations, you all. Think about people who, and their deserts, they're destroyed. The alcoholisms that occur in this population, the diseases that were brought, the smallpox, all these things that occurred way back in the days that brought a lack of harmony, that brought illness, that brought death. When someone is sick, and it still is to this day, even if you choose to leave the tribe and live within the United States even, the person, instead of necessarily dealing with Western traditions, the person can choose to go back to their tribe to be treated, to have justice dealt with. So they drove drunk and had got a DUI. They need alcohol abuse treatment. Because of the beliefs and value system, they may choose and to go back and get treated with the tribe. Is this a cop-out to get out of getting in trouble? Not really, because the people that they're with are people who actually know them, that can hold them extremely accountable. This is very, very personal. And this is part of what they believe in. Over in Orange Park, we have a patient there. This was about 4 terms ago. She is from an indigenous tribe, and more of her mother still lives with that tribe. She goes in and out, and she unfortunately it has chronic mental illness, and it causes her to become very delusional in her thinking. And she was talking about the fact of we were discussing the fact that sometimes the young we were talking about coming of age, and some of the young men and women take a special journey that actually is involving hallucinogens. Okay, and the patients on the unit happen to be talking about and bragging about their substance abuse issues at the time, and she's one that has abused drugs. Okay, and she was abusing them, and she didn't think that any of us were very educated on this topic. Okay, and so we started to actually have an intelligent conversation, and I started to discuss some of the processes that are actually involved, and that you just don't get to use LSD basically and hallucinogens just for the fun of it. There is a whole process that is involved where you have to show a lot of responsibility, endurance, tasks are given to you. And it takes years, not months, days, but years of grueling responsibilities before you are ever given this opportunity to go out in nature, be given a hallucinogen, to become one with nature by using a hallucinogen. And so we were having this conversation about this, and the conversation ended up becoming very serious, and the students were learning a whole mess of information at the same time, because she actually started to tell the truth about what was really going on, and that she actually had not used or gotten to participate in this ritual and rite of passage because of the fact of her illness and her irresponsibility, and that she was not responsible enough to maintain the behaviors that were required due to her illness. And she was sharing this, but also the other patients were learning about what was actually going on. And so they were all of a sudden quite surprised. So this isn't like a recreational activity. And she was like, no, this is something you do once or twice in your lifetime. This is not something that you do on an everyday basis. This is a special moment of your life. And they were all quite surprised and taken back by what she was saying and listening to her, because once you got past her facade and you literally listened to what she truly believes, it made a difference. And she actually started to get down and into her treatment while she was there. And then she made the decision to go back to the tribe again and start working on trying to find balance and harmony and giving back to her community, and making a difference in her life and into the community again. So it all makes a huge difference on how we're dealing with things. Also, I want to put with your mind, body, and spirit, with our Eastern cultures. There is a lot of times when a patient is not going to be able to tell you what is going on with them because they are not going to have words. And this can also happen with your indigenous cultures. They won't have words to describe what they're experiencing. So Mr. H lives with his daughter who becomes concerned about his memory. Sometimes he says he's going out to the garden, but then he just disappears. Yesterday I was frantic, and then a neighbor brought him home from the shops nearly a mile away. When I said, "Dad, where were you trying to go?" he says, "I don't know. Did I get there?" What statement is he making here? I don't know. Where did I get there? What culture is he talking from? Is that Western statement, an Eastern statement, or an indigenous statement? If you said Eastern, because he said, "I don't know, but did I get there?" because he had a fate and a duty to comply, and that kind of sounds like it might fit into that, you're absolutely correct. So although his daughter has been here for almost 15 years, Mr. H is fairly new immigrant. He speaks some English and is highly educated. And although you have had no time to ask many questions, he is clearly of a more Eastern tradition. Which attitude would you expect him to share? Disease is caused by fluctuation and opposing forces. Disease is part of one's fate, and we have a duty to comply. Disease is a cause, and the treatment is aimed at the cause. If you said B, you are absolutely correct. So our next piece is impact of culture on mental health. So this is on page 81, y'all. Okay, we're going to talk about a few components here. Enculturation. This is one of your fun terms. What this means is the process of which your worldviews, your beliefs, and your values and practices are transmitted. So enculturation. So typically, this is how your child learns right and wrong. Your parents usually teach you. Enculturation. Okay, your grandparents, your parents, your family teaches you your value system, your beliefs, your practices. And they start very early. You need to understand when you are 1, 2, 3, 4 years old, you're already teaching your kid everything they know. They learn everything. They pick up everything. They're learning, they're hearing, they're repeating everything that's going on. And deviance from a cultural expectation can be defined as an illness. Okay? So when you see deviation, that's where you define illness. So I'm going to give you an example. We had a patient. She was about 31, 32 years old. She got involuntarily admitted to our psych hospital many years back. She was picked up by the police at a grave site and overnight at about maybe 1 or 2 o'clock in the morning. Okay. She was not originally from the United States. I don't remember exactly what country she was from, but I do know that they spoke it was partly French, but it wasn't fully French language, because French, we could at least found somebody who could speak French. But it was a broken French language. Okay, that's the best I can remember, because I cannot remember exactly what the language was. And anyway, what had happened is they found her at the gravesite. She was laying on top of a recently buried person, so the ground was fresh, and she was what we call wailing, okay, meaning kind of crying, rocking back and forth, and then she'd lay on the grave, okay? And police were called because there was a disturbance at the gravesite. She was asked to leave. She refused to leave. She spoke some English, but not a lot of English, that it was very clearly understood what she was saying. And the police ended up Baker acting because she refused to leave. Okay, and that she wasn't making any kind of sense of what she was doing. And according to it, just seemed very odd in Western society. That was just odd behavior. So she got put on a hold. We have her. We're trying to find someone that can translate this language. We're trying to get a hold of family, someone that can help us understand what is going on. From what she's telling us, her grandfather was buried. And she is saying that she needs to stay with his body because he may rise from his grave. So there's a mix of Catholic religion in here, and you need to stay at the gravesite for 72 hours because on the 3rd day he may rise from his grave, and someone needs to be there to receive him. And normally it is the spouse that stays with the person, but she was staying because her grandmother was too sick to do so, and so it was her duty to stay there at the gravesite. And her parents were not in the United States. And so everybody's trying to figure out if this is true, false, made up, because no one has ever heard of this before. And so no one's answering the phone at the house, so no one can reach anybody there. We can't find someone to translate so we can fully understand the whole story, but this is what we're kind of understanding in this communication. So is she delusional? Is she telling us the truth? We're trying to research where she's from, trying to find out what's going on. Okay, and you're getting a little bit more of the story because this is the aftermath of getting the whole picture that you're hearing this conversation, because we didn't even have this much in the beginning of this conversation. So did she need to stay on an involuntary status? Could we let her go safely? It took us almost 36 hours to get this figured out. And she is in great deal of distress because nobody's at the grave site. Okay. And these are strong beliefs. And this was within her normal cultural expectations. She needed to be there. What had happened is the funeral home had made arrangements with cemeteries um, um, owner that the family member could stay there. However, it was not fully communicated to the people who were physically running the cemetery. And so there was a breakdown in communication. And so it took a lot of work getting hold of the funeral home folks to finally get the story and figure out the whole pieces so we could release her. Yeah, it was a mess. Poor woman. Could you just imagine something like that happening to you? Okay, ethnocentrism. All right, think of supremacy when you hear that word. Your culture is the best and the supreme over all other cultures. Ethnocentrism. Okay. And then you have cultural imposition. This is what you, as a healthcare provider, can cause to your patient. This is when you impose your own beliefs, practices, and values onto your patient, and you can harm your patient. This is where, when your patient's family members must do the patient's hygiene care, and you don't know that, you didn't listen, you didn't check, and you went ahead and did it, and it caused harm and damage. And this family is from Eastern tradition, and the patient gets sick and declines later in the day. And that son, who was supposed to take care of their father's hygiene, did not come in and do it because he had to go to work first. He had a duty to comply. He had a fate to comply in his duty, and it caused his father's illness to worsen. That can cause great harm because you imposed your beliefs and practices over, because you had a time and a date you thought those things needed to get done without checking about what their culture responsibilities are. You have to coordinate with them and arrange it in the care plan and to make sure that we have those things covered and cover your patient. All right, so when we're looking at cultural barriers to communication and quality, okay, let's talk about communication components. So there's some pieces you need to definitely start thinking about. One of them is looking at the nonverbal communication patterns, okay? Table 5.3 on page 81. Where should we be looking and seeing eye contact, personal space, touch, facial expressions and gestures? In a Hispanic group, I expect a lot of touching. It would be so irresponsible and cold to come walking in with a pamphlet and say to someone of Hispanic culture, read this and learn about this material. That would be so insulting to them. Instead, I would be walking in and shaking hands and saying hello and introducing myself, and maybe even putting my hand on their forearm and saying, I understand that you have been diagnosed with diabetes and that you're going to have some changes in how you're eating and how you're doing, and that I empathize that this may be difficult for you, but you're going to be able to handle this and do this. Now, I have some pictures here that I want you to look at. These are some food groups that we're going to start working on and altering. And I know that you have some favorite foods that you want to be able to eat, but you're going to cut back a little bit on those. You can have some of them, but not all the time. And start working with that person to start breaking down the barriers, okay? But touch makes a difference. It opens it up for that. But if I have somebody from German descent, touching them is going to be like the wrong thing to do. A sturdy handshake maybe be okay, But outside of that, no way, Jose. And handing them materials and asking them to read it, and then we're going to have a discussion, would be much more acceptable to do and would be respectful for them. So it's very important that you know your audience and how you're doing and what you're doing, okay? There's low touch versus high touch, and frequency and how often you should or shouldn't be touching. Very important to know. You need to know the norms of etiquette. That is in box 5.1 on page 81. What's formal and how formal? Introducing and addressing the person by their given name, their first name, their last name, Mr. or Mrs. Okay, what should you do? What's your tone of voice? Do you talk deeper or you talk higher? If you talk really high like this, can they hear you? Do you need to talk low? Do you talk slow? Do you talk fast? Do you talk really rapid like this and nobody can hear you and understand you because you're talking so fast that you're talking like an oxen jerk? What did I just say? So those are those questions you need to be asking. Do you offer food and drink? Do you accept hospitality? Do you not? Those are those things that you need to look at and be respectful for. Okay? Look over, know those things, become much more familiar. Then on page 82, you have culture, beliefs, and value systems. Okay, predominant culture values in the United States versus other areas. Cultural beliefs and values regarding health and illness. This makes a very big difference. And looking at what the United States sees things versus other cultures, you have to have that awareness. There is a huge stigma, you guys, in our country, let alone in other countries regarding mental illness. There's so much shame that is still associated with mental illness. It's sad, but it is so true. It's getting better, but there's still problems. Again, get an interpreter in, a translator in, to ensure that we have somebody who is certified in providing education, communication to our patients. We want to get somebody who is close as possible, the same sex as the patient that we have, so that they are able to relate to that patient as much as possible to be able to give us the information that we need. So when the patient is saying that they are stressed about school, that their family's having these expectations, they came from another country and their family wants them to support them, but they want to be independent and function in Western society, but their family still wants them to be in Eastern society and they don't know what to do, and so they just want to die, that interpreter or translator is able to communicate that to us. And so by having them be the same age, by having them be the same sex, it allows comfort for that patient to be able to relate that information. And so that's why we want to do that as much as possible. But again, they need to be certified in being able to discuss medical information. It's no different than when you need to do the same thing for if the law's involved in the court system, doing the same thing. Because this is where we start getting into misdiagnoses. It starts with the communication. That's where it starts and begins. And it continues to bring on issues. And also with mental illness, I want to bring another piece in. when there is shame that is associated with mental illness, in the United States, we, in the Western society, Western tradition, we see a person as an individual. But when you are of Eastern tradition or of an indigenous tradition, when you have mental illness and that is considered shameful, who do you bring the shame to? Is it just to the individual? Or is it to the family or to the tribe? It brings it to the whole family. So then you've got a family or a tribe that is going to hide that illness and potentially keep it a secret. So now we've got cultural bound syndromes, okay? These are patterns, okay, that can, what do I want to say, that have, what do I want to call it, that are basically showing clusters that are symptoms, okay, that a person experiences that are distinct in a cultural group, and we call them culture-bound syndromes. So a certain culture, everybody seems to have these same kind of symptoms for a certain type of thing. We'll go through this in just a second and I'll get more specific. You have cultural idioms of distress, and this is a way that somebody expresses their distress, like I'm depressed or I'm a nervous wreck. They're kind of how they express how they're feeling, okay? And then you have cultural explanations. Let's see, how do I want to word that one? That can seem erotic or irrational to a nurse, but it's just how a person's trying to explain something. Okay, so with this in mind, you have some explanations of some of these illnesses in writing. And in box 5.2, it goes through these a little bit more in detail, but you also have one of the biggies is attack of the nerves, attack des nervos, okay, and ghost sickness is another one. These are cultural-based illnesses, and there's abnormal behaviors, and these are culturally acceptable ways a person expresses that they can no longer endure, okay, no longer endure the stress of their lives, okay? So basically, both of these have to do with having anxiety, okay? And attack of the nerves is basically somebody trembling, having palpitation. They're going to have dyspnea. They're going to be dizzy. They're going to faint. Okay, and they think that they're having evil spirits, okay, because of intolerable stress. And so basically this person is going to show up in the ER thinking they're having a heart attack and they're dying, and they need their spiritual healer to come in to heal them, okay? And they're going to be complaining of chest pain. And you're going to think you need to have that an EKG is going to still need to get done, but you're going to find that they're not having a heart attack. But this is how this person presents, okay? Ghost sickness is basically when this person will tell you that they're out of their mind, okay? They're weak, they have dyspnea, they're having bad dreams, and that's thought to be caused by evil spirits, okay? And they need their healer, and they need to have their singer call forth and bring powerful healing rituals. The other one that's not here, but it's in your HESI book, has to do with coining. because I worked in pediatrics for so long, I've had to deal with coining. Coining is actually a technique that's a treatment. It's not a culture-bound syndrome. It's a treatment to help heal a child who has respiratory issues. And what they do is they take a coin, a metal, and they take it and rub it up and down the chest wall, back side and the chest, front chest and the back, up and down, and it leaves really bad red marks. Okay, they're trying to help get their breathing improved by removing all the bad with the coin. And in so doing, it looks like this child has been severely abused, and you end up calling DCF and the police in because you thought this child had been beaten to death, basically, somehow with all these marks on them. It's called coining, okay? You gotta do a little education with the family because they did it too hard. Have any of you guys ever seen, I cannot think of what it's called at this moment, but it's very similar to the idea of coining, but they're the little suction cups that you put on. You see a lot of celebrities doing it. It's very similar to the idea of acupuncture, except for it's with little cups that get heated up, glass cups, and it suctions onto the skin. These are some of the things done for treating some of these syndromes, okay? Drinking something warm and hot. With COVID-19, one of the recommendations that came out of China is when you have but it's true with any respiratory illness, if you've got the flu, you have a sinus infection, drinking warm things like tea, broth, that kind of stuff actually helps break up phlegm. And so one of the recommendations with COVID-19 was to drink warm green tea, that would help with part of the cure. So these are some of the things to be aware. Now, the other piece on here is genetic variations of pharmacodynamics. Okay, so what are we talking about that? So the big things with genetics that I want to just kind of reinforce with you is that we now have the ability to draw blood and within 3 to 5 days do a test with your DNA to figure out which type of antidepressant will be most effective for you. Which antipsychotic medication might be most effective for you. So that we can at least get you, if we didn't put you on the right one in the first place, we can switch you over and get you started on the best one that will work for you. So that is kind of the process and the thoughts behind getting the DNA testing. But also, I know that if you are of African American descent or of Asian descent, and I give you risperidone, I know that you are at greater risk of having extrapyramidal symptoms, of having a movement disorder. I know that you are, if I give you, and if you're Asian descent and you take Tegretol, you're at greater risk of having Stevens-Johnson syndrome. Because I know these things should not be being prescribed to you as the first drugs of choice. And because I know this and I am a nurse, when a doctor goes and does this, then I need to go to the doctor and say, I just want to check in with you. This person is of Asian descent. Is this the drug of choice you're really choosing for them to start with because of the Stevens-Johnson syndrome? And I check in with the doctor to make sure that that was the decision that was made, and to also make sure that that was a discussion that was had with the patient, that risk. Because that is part of my responsibilities to ensure patient safety. So, Mr. H is almost definitely an immigrant brought here by his daughter just 2 years ago. Expressively so she and her partner could take care of him. So, cultural competencies, psychiatric mental health nurses. So these are the 5 constructs of what you need to do to be culturally competent. Okay, you've got to be competent, you guys. You need to know how to be culturally aware, how to be culturally knowledgeable, how to do cultural encounters, how to do cultural skills, and how to be cultural desires. You will be tested. You will need to be able to pick out examples of which one is the best example of displaying this. Okay, so when you're looking at this, these examples are laid in here, and it starts on page 86 and works your way through. Okay, so I'm going to and I just broke down brief things on here. Take and walk yourself through these a little bit. So, cultural awareness. This is where you are examining your own beliefs and values and the practices of your own culture. You recognize your cultural components, okay? What do you believe? You know, one of the things that I love to do is ask people, how do they ring in the new year? What do you practice? What are your beliefs? And I hear a lot of fun things. I hear people talk about the fact that they never do laundry on the New Year day. Never, ever, ever. Because it puts people at risk of washing people out of their lives. That they must have a man be the first person to enter the house on the New Year day with their pockets full of money. That some people need to eat pork on the New Year's Day because when pigs go and scrounge for food, they use their snout to move food forward in the ground, and that pushes everything forward for good luck. I hear about black beans and greens. I hear a whole mess of different things that mean different elements for bringing in the New Year's. I hear about fireworks and ending the year in a bang to celebrate the new year. So there's a lot of different cultural awareness things. You need to know where your values and your beliefs are, so you try to be careful not to. What was the term, you guys? Do you remember? What's the term? Do you remember the term? I'm just waiting for you to remember it, because I'm not going to say it. I want to see if you remember it. It has to do about imposing your cultural beliefs on the patient. Okay, so some of the things to help you is to also then work on recognizing that you're in a cultural encounter, okay? And that you are intersecting cultural encounters. Probably one of the worst things that I do that just for me is I get a little snooty sometimes about food, okay? When I see somebody eating food, okay? I am not a fish person. I'll own it. I am not a fish person. I don't really like to eat fish unless it's blackened and it's mahi-mahi and it's fresh. Because if it's fishy tasty, I'm just not in for the bang for it, you guys. Just it is not me. My parents tried really hard, but it's just not in my taste bud repertoire, okay? And it's the same thing for shrimp, and that has to all do with the texture. I also don't do liver, and I don't do snails. They're too gooey and chewy. It just drives me crazy, okay? I also don't do lamb, And I have had lamb many different ways, to the point one of my physicians that I worked in clinical research with finally just couldn't take it anymore and said, I don't know what it is and why you keep trying to eat lamb, but stop it. You're killing me. You don't like lamb. Stop it. Just stop it. Okay. So anyway, with that being said, I get a little snooty about food and I always go, ooh, what are you eating? I can't believe you're eating that. Well, that's my one negative on my cultural awareness, that I impose my own values and beliefs, even though it's not exactly a culture, it's just my little snooty food bug thing about fishy stuff mostly. But be aware that you're intersecting when you're working with somebody else or you're with a patient, and that the patient and you are always interacting and there's a cultural connection going on. Cultural knowledge. There's many ways you can get cultural knowledge. One of them is by attending cultural events and programs. Hey, we used to hold World of Nations around here all the time. They used to be pretty good back in the day. Now it's not as big or as elaborate sometimes as it used to be. But we do have so many events between here and St. Augustine, Fernandina Beach, all around. But just attending some of those fun programs, there's a lot of learning that can go on. Even when it's with your small children, there's still elements to do. Make friends with a diverse cultural group. Learn by studying. Learn by going and helping different helping others. Establish rapport. Ask cultural relevant questions. Identify cultural variables to be considered. People are open. You'd be quite surprised on how much learning someone can do just by getting cultural knowledge, okay? Now, cultural encounters. This is when you're going to now need to work on not having stereotyping. Help nurses gain confidence in cross-cultural interactions. Help nurses avoid or reduce cultural pain, so you're not inflicting pain. This is helping other people gain insight, okay? Helping them gain understanding, getting confident about what's going on, helping yourself. Don't get caught in a stereotype, because not everything doesn't apply to all people. Cultural skills. The ability to perform a cultural assessment using professional medical interpreter to ensure meaningful communication. Use culturally sensitive assessment tools. When you're doing this, you want to set a goal with your patient that's mutually agreeable and a therapeutic plan. And that everybody is in agreement to this, because you can make a treatment plan, you guys, that everybody is not. You can write a beautiful treatment plan, but if your patient doesn't buy into it, it's not going to work. So I'll give you an example. You have somebody that is of an indigenous culture. They want to have herbs. They do not want to take a Western pill, okay? Or they won't take the Western pill, and they need it because they need insulin. They have diabetes, okay? But they only want herbs. And one of the things that there are some herbs that cannot be taken with insulin. They will have a bad effect. So the best thing to be able to do is to actually have that shaman come in. So you want to talk with the doctor and say, hey, listen, we can't get them to do this insulin. What do you think about having the shaman come in and meet with you, and you guys talk about what the shaman could provide that won't interfere with insulin, and see if we can't get the shaman to get the patient to take the insulin with whatever the shaman can provide. And we work together and make this happen. You're an advocate for the patient, you guys. And most likely that doctor is going to say, yeah, let's go for it, and get that shaman in the door and be able to make this happen. And you'll be quite surprised how well this will work. And this will help facilitate that health and recovery of this patient. It won't cause any harm to the patient. And everybody and will have that positive outcome occur. So Mr. H is admitted to your unit, and in your assessment, you identify some cultural patterns that may support or interfere with his health and recovery process. What can you do? So you're going to what? You're going to talk with him, you're going to talk with his daughter, and you're going to work on preserving and maintaining, accommodating and negotiating, repatterning and restructuring and reframing his care that preserves his culture from a Western perspective, that promotes his health and well-being. So everything that he values and he practices that are helpful and don't cause harm, we want to accommodate and negotiate. We want to repattern and restructure anything that is going to cause him any potential harm. Cultural desire. This is when you want to truly let somebody know you genuinely are concerned for their welfare. You are really willing to listen to their point of view and understand it. You have patience, consideration, and empathy. So which worldview would the nurse anticipate from a client who says it's important to save enough money to take care of yourself in your old age? We should not rely on anyone else to take care of us. Is it Eastern for balance, Western for science, or Indigenous for harmony? If you said B, Western, you're right on target. Which term refers to an individual's beliefs that their cultural values and practices are correct and superior to those of others? Assimilation, enculturation, ethnocentrism, somatization. If you said C, you are absolutely correct. Which communication technique would be most effective for a nurse to use during an assessment interview with an adult Native American patient? An open and friendly, ask direct questions, touch the patient's arm or hand occasionally for reassurance. Frequent nonverbal behaviors such as gestures and smiles. Make an unemotional face to express negatives. Soft voice. Break eye contact occasionally. General leads and reflective techniques. A stern voice. Broken eye contact. Minimal gestures. Direct questions. If you said C, the soft voice, break eye contact occasionally, general leads and reflective techniques, That's the correct one. The last one that I want to discuss real quick that doesn't have a slide is if you were being sent to a reservation to a medication clinic as a nurse, what would you do to obtain cultural knowledge? Would you study up on that particular tribe and read up on the tribe? Would you read up on medications? Would you read up on the medications and how that affects that particular tribe? Any studies that are specific to the tribe and the reactions to the medications? Would you read up on their cultures and their beliefs of that tribe? Which one would you pick? If you said that you would read up on the medications and the effects of that medication on that tribe, that would be the correct answers because it's specifically going for a medication clinic. If your question, and this is the tricky with NCLEX questions, if your question was about a clinic on a reservation, and it didn't say it was a medication clinic, but it was just a clinic, then you would be reading up on their cultural beliefs and practices of that tribe. But because it was a medication clinic, you need to know specifically how that particular population reacts and has any sensitivities to medications. All right, you guys, have a great night. I will talk to you later.